hanging out in the bottom of her squat, stretching out her low back, just rounded position. I just came over here to just ask her what's up. I know that her past, she's a competitive athlete. She's played high-level rugby, soccer, and now she's got into CrossFit as kind of her replacement for her sport.
Actually, my back playing rugby 3 years ago.
Right.
So no more contact sports.
And so you can still do CrossFit
Yeah.
with a big injury like that. You had to go through all the rehab to take consideration during the workouts, obviously, and there's probably some stuff you got to do after. So let's fill in the people as to what that looks like for someone like yourself. So before you even considered doing CrossFit when you were still injured, what did your rehab kind of look like?
When I first started, back when I could start doing things again, I did a lot of core stability work because when I hurt it, I did nothing, so I lost all stability in like my abdominals, and, like my glutes and my hamstrings. So we did a lot of stability kind of things.
So things like planking,
bear crawls, dead bugs.
So what are you doing with the dead bug?
So dead bugs, I was told to big belly breaths to work on the internal abdominals rather than the external beach body.
Right, you're looking to control.
Yeah, so it was more of take a big belly breath.
Create
While
stability.
you're doing it, the idea is to try to keep the back on the ground instead of letting it do this, which is a little bit easier, but adds a lot of strain onto the back.
Right. And so you're really stiff down there.
Yeah.
We need to get some movement out of you, but first we need that stability to make sure that you're not going to get into flexion extension and cause any pain there. So if we had a hierarchy of kind of how important these exercises are or how easy to difficult these are, that's probably the easiest. What was next difficult? Once you mastered that, where would you go?
I added a ball into it actually after that. So I had to hold the ball with the opposite arm's leg while I did it.
Right.
And then straighten the leg instead of having a bent knee, it was with a straight leg.
Yep.
And then we added in like bear crawls.
Right. Okay, so you went, hold on to that thought, you went from basic dead bug to then creating a distraction for yourself and still thinking, can I still hold this position with the distraction? Then you went to planking type positions before bear crawl or bear crawl right away?
I did those two together.
Right, okay.
Kind of. So we
Show me what a bear crawl kind of looks like.
Bear crawl was harder than the dead bug for me because I had to actually hold my back up instead of let it dip in, which was
stay
really
nice and
easy.
flat through there.
And then kind of walking while holding it.
Yeah. Again, name of the game here is stability. Try and create stability. She's got that broken back, but as long as she's stable, she's in good shape, good position, she'll be just fine. So that's your rehab. What does, now that we're talking about performance, what does a pre-workout type routine look for you?
I have to work on activating my glutes a lot and warming up my hamstrings because if those get tight, it kind of just pulls and friction to my side starts to inflame.
Right.
So I do a lot of like glute bridges.
Yeah, absolutely.
I'm still really bad at doing one-legged ones because I have a tendency to start turning.
Yeah, side effect of your injury.
Yeah, so just straight up and down.
Perfect.
I try to avoid doing the one-legged ones.
That's just fine, yeah. So pre-workout, glute bridges, glute activation, that type of stuff. Banded walking, that type of stuff, cool.
So the marching band.
Now talking about during the workout, you got some squats, deadlifts, whatever it is that day. What things do you have to consider?
I like to keep my eyes open for running ones because the running ones, the SI rubs the whole time.
Right.
And they have a tendency to light up my back.
And also with running, most of us don't have optimal technique and we tend to extend a little bit on that run. Is that something that you're aware
so
of?
when I was learning how to run again, it sounds really sad, I would run straight up. And I had to learn how to run like this, so I did a lot of stairs.
Right.
Because that naturally puts you in this angle, which then rounded my back rather than having me completely straight up and down.
Yeah. Okay. Anything else you gotta think of during a workout? Not a specific exercise or anything, just general concepts?
Nothing really. Maybe like when I see burpees, I know I'm going to be doing a lot of like keeping my back like this to get up and down, and then I have to be careful because then you're shooting back.
Yeah, totally.
So it's like
go back down there for 1 second.
Extension.
So typically, this burpee type motion, will cause a little bit of fatigue through that low back. In most of us, it's not a bad position just for her specifically. She's got this history of contact sports, soccer, dance. She's put some miles on her body. So just for her specifically, she has a shorter fuse here than most people. Usually that's a pretty okay shape, but
I find if I squeeze my glutes and keep my knees off the ground, it's a little better because then I can sort of just like push up without doing the whole back arch. But when it's paired with a whole bunch of things and I get tired and lazy, then my back starts to round.
And you nailed it. As soon as you squeeze your butt, it's going to keep that pelvis a little bit more neutral than if you were squeezing your butt.
So I guess that's what I have to look for, is just constantly keeping my butt activated when I'm doing workouts.
Perfect, absolutely.
If I let it relax, then
nailed it. That's exactly what I was looking for. And then finally, post-workout, what are we looking at?
I do a lot of glute stretching, and hamstring stretching. Those are my main focus. And I'll do a little stretching on the front to just keep everything.
Yeah, so that's what I was going to say. So what about this idea that maybe the psoas, the hip flexors get a little tight and that pulls you into extension? Have you thought about that at all?
The flexors are,
Yeah, so for that, let's talk about that. If those psoas tighten up a little bit, it's going to shorten right there and pull you into extension kind of all day if you get tight hip flexors. So that's going to cause that pain that Alex is dealing with. So if we can get psoas to relax a little bit, get her back a little bit flatter, it's going to be beneficial. So one of those stretches that is great for this is going to be like a super banded kelp stretch. So if you want to stand on up, throw your foot in there. Yep, you're going to face the bands. Turn around for me. Yep. Throw that up into the butt crease. A little bit higher if you can. You can keep pulling that up, that's all right. Step on back with that right knee. Kneel down. So this is pretty simple. We've probably all seen this or in the gym. Nothing new, but you can already see that she's leaning into it a little bit here. So what I'm gonna ask her to do is close her rib cage, keep nice and neutral at that spine, and then push that hip bone on the right side forward, while then just stretching out that hip flexor to the front. So she's done all this posterior stuff. Maybe take a little bit of look at the interior just through the psoas. Yeah? Think that'll help?
Yeah.
Cool.